The pathogen Treponema pallidum is a part of the Spiroctaceae family, which is a gram-negative bacteria that causes the sexually transmitted disease syphilis. Syphilis can be diagnosed two ways, by a simple blood test called the rapid plasma reading test or by a physician performing a dark field exam of a culture. This is produced by collecting a sample of a syphilitic canker from the skin or mouth that demonstrates characteristics of Treponema pallidum. Syphilis is directly transmitted by anal, oral, or vaginal contact of open cankers or syphilitic sores. Symptoms generally occur 3 to 4 weeks after initial infection. Treponema pallidum enters the host through an abrasion of the skin, which allows it to enter the mucous membrane and attack epithelial, endothelial, and fibroblast cells. The pathogen invades the bloodstream and spinal fluid, spreading the disease throughout the body and replicating spirochetes, which is the syphilis bacterium. Syphilis is a systemic disease, which means it can affect all of the body's organs and systems. There are specific symptoms associated with each stage. Syphilis goes through 4 stages: primary, secondary, latent, and tertiary. Primary stage. Symptoms such as small, round, painless sores and cankers appear 3 to 4 weeks after initial infection. The sores occur on the genitals, rectum, or mouth. Half of infected women and 1/3 of infected men are unaware of their sores. Secondary stage, also known as the disseminated disease stage because of the multiplication and spread of the treponemal spirochetes throughout the body. Symptoms start 6 to 12 weeks after initial infection and include highly contagious red rashes on the palms, soles, and other parts of the body. Latent stage, also known as the hidden stage, is when the infection lies dormant or inactive without causing symptoms. Tertiary stage, also known as the late stage, occurs in 1/3 of untreated patients. It can either occur right after the secondary stage or years later in the latent stage. During the tertiary stage, the disease is not active and cannot be transmitted. It can lead to damaged nerve cells in the brain and spinal cord, cardiovascular problems, paralysis, blindness, and death. Pregnant women infected with syphilis are at risk for miscarriages, stillbirths, or premature births. Syphilis can pass through the birth canal during labor or through the placenta during pregnancy, resulting in infection of the baby with congenital syphilis. The primary treatment for syphilis is the antibiotic penicillin. Each dosage and length of treatment depends on the stage of infection. Avoid sexual intercourse until treated completely. Treatment is most effective when followed properly. The best way to prevent syphilis is by practicing safe sex because even if the infected person shows no symptoms, it can still be transmitted. Syphilis is caused by the bacterium Treponema pallidum. It can be treated with antibiotics, but if left untreated, causes damage to major organ systems. There are 4 stages, and in each stage, different symptoms. It is sexually transmitted, but can also be transmitted to a baby through the placenta or birth canal. Take precautions while pregnant or sexually active to make sure it doesn't spread.
Created using Powtoon.